Okay, let's jump right in. Pregnancy brings a whole host of expected changes, right? But today, we're diving into a really fascinating and honestly, surprisingly common medical mystery that catches so many expectant mothers completely off guard. In this explainer, we're going to break down the exact mechanics, the diagnostic steps, and the real solutions for carpal tunnel syndrome during pregnancy, looking straight at the very latest clinical guidelines. It's a topic that, frankly, doesn't get nearly enough attention, but when you look at the data, understanding it is absolutely vital.
So have you ever woken up in the middle of the night with painfully numb hands during pregnancy? Or maybe you know someone who has. Well, you are definitely not alone. We're going to explore this deeply frustrating, completely sleep-stealing symptom today. It's exactly the kind of condition that sends countless pregnant patients straight to their primary care or obstetrician clinicians, just exhausted and looking for answers.
Here is our roadmap for today's explainer. First, waking up numb. Second, the pregnancy connection. Third, diagnosing the syndrome. Fourth, step treatment options. And finally, number 5, the postpartum outlook.
Starting with Section 1, waking up numb, the midnight symptoms.
The contrast in the data here is just absolutely staggering. In the general population, only about 1 to 5% of people experience carpal tunnel syndrome. But during pregnancy, a massive 31 to 62% of women will develop it. That's a wild jump in incidence. It usually shows up bilaterally, meaning in both hands, and typically kicks in during the 3rd trimester, though honestly it can happen at any point. We just cannot ignore a spike like that.
And the numbness we're talking about hits a very specific spot. The symptoms localize directly to the radial 3.5 digits of the hand, so basically your thumb, index, middle, and half of your ring finger. It's entirely driven by the median nerve. Now, while it usually starts out as just a sensory issue, that tingling and numbness that wakes you up at 2 a.m., prolonged compression can actually lead to real weakness in the muscles right at the base of the thumb.
Section 2, the pregnancy connection and why this actually happens.
To really get why this happens, we first have to understand the syndrome itself. Think of the carpal tunnel as a very crowded, rigid hallway in your wrist, where the median nerve is just constantly fighting for room. When pressure inside that small space goes up, the blood flow to the nerve drops. That lack of blood flow, the decreased neuroperfusion, is exactly what causes that telltale tingling, pain, and eventual weakness.
So what's going on during pregnancy? Well, that rigid hallway gets even tighter. It's basically a perfect storm of systemic fluid shifts and hormonal fluctuations that cause swelling right inside the carpal tunnel. But there's also this fascinating mechanical factor. The body secretes a hormone called relaxin. Relaxin literally causes the transverse carpal ligament in the rest to flatten out. This physically shrinks the volume of the tunnel, leaving the poor median nerve with absolutely nowhere to expand.
Moving on to Section 3, diagnosing the syndrome through clinical evaluation. Before anyone jumps to expensive ultrasounds or nerve conduction studies, doctors actually rely on some brilliant, hands-on clinical tests right in the exam room. For instance, tapping gently on the nerve to see if it causes tingling, that's the Tunnel test. Or having the patient flex their wrists for about 60 seconds to try and reproduce the symptoms, which is the Fallon test. Applying direct pressure over the nerve is the Durkin test. And finally, checking for sensory dullness with a 2-point discrimination test. They're quick, simple ways to pinpoint median nerve compression immediately.
To take it a step further and actually quantify how bad it is without doing anything invasive, clinicians use the CTS-6 scoring system. I love tools like this because they're reproducible and, best of all, totally free. Specific symptoms earn you points. Nocturnal numbness, that gets you 4 points. A positive Fallon test, that adds 5. If your total score is under 17, it strongly points toward a mild to moderate case, meaning conservative care is the way to go. Higher scores might mean severe compression requiring a bit more aggressive intervention.
Section 4, treatment options, using a stepped approach.
The clinical guidelines recommend a really logical stepped escalation for treatment. It almost always kicks off with neutral wrist splinting at night. This physically stops the wrist from bending while you sleep. Next, we progress to specialized exercises. If those don't cut it, the medical team will move to localized injections. And finally, surgical release is kept as a strict last resort, which honestly is rarely needed during the pregnancy itself.
So if the splinting isn't enough, we bring in specific nerve and tendon gliding exercises. These targeted movements help mobilize the median nerve against the surrounding tissue. It physically reduces swelling and breaks up soft tissue adhesions that might be trapping the nerve. Clinical trials actually show these exercises are an incredibly trusted, completely non-invasive way to increase hand function and dial back symptom severity for pregnant patients.
Now, what if conservative measures like the splinting and the exercises just aren't giving any relief after 6 to 8 weeks? The next highly effective step is a targeted corticosteroid injection, something like triamcinolone, placed just proximal to the wrist crease directly into the carpal tunnel. These are generally considered very safe during pregnancy, and they offer powerful, localized relief without having to rely on systemic medications.
Finally, Section 5, the postpartum outlook and life after delivery.
The really hopeful story here is that because the main triggers of this syndrome are tied directly to the physiological state of being pregnant, time is often the absolute best healer. As those postpartum fluid shifts normalize and pregnancy weight decreases, about 50% of patients see total resolution of their symptoms within just a year, and by year 3, 2/3 of patients are completely symptom-free. This is exactly why surgeons typically hold off on any surgical release until well into the postpartum period, saving it only for cases that stubbornly refuse to improve once the body's back to its non-pregnant state.
Which wraps up our explainer today, but it leaves us with a pretty critical question to ponder. We've seen the data, right? Up to 62% of pregnant women suffer from a condition that wrecks their sleep and daily function. So how can we use this structured clinical knowledge to better validate and treat the hidden physical tolls of pregnancy? Understanding the mechanics and the incredibly effective, safe treatments that are available is really the first step in advocating for complete, comprehensive maternal care. I hope this breakdown gave you a much clearer picture of exactly what's happening and how to fix it. Thanks for tuning in.